very much. You've been very, very helpful.
Sure.
And I think that as we look at prostate cancer advances and what we call comprehensive prostate cancer therapies moving forward for those individuals who you're talking about on one end of the spectrum, which is early localized therapies, those men who have systemic recurrences and need to have systemic therapies and the primary modalities aren't working, the advanced prostate cancer therapies that are all now available are presently being used in a sequencing form. And the debate is what's the right sequence? Well, I think that the real future is going to be no longer sequencing but cluster therapy. Because if you look at other modalities for cancers in the human body, if it's lymphomas, it might be CHOP. If it's leukemias, they get cluster. If you look at breast cancer, bladder cancer, they all get cluster therapies. We haven't really gotten that smart yet in prostate cancer because many of the modalities that are now being used for advanced therapies have just been developed. Now we're finding that if you put them together, so maybe a combination of, say, Provenge, which is immune therapy, in combination with Xofigo, which is a radio pharmaceutical that actually prevents and helps bony metastases, in combination with the third generation of oral anti-androgen, which is enzalutamide. These drugs, maybe in combination, may be more effective than if done in sequence. And so there are trials out there, and that's why I'm actually very proud that we, in our organization, are part of trials and actually support trials. I know that Beaumont has many clinical trials. And so one thing, if I could recommend anything, is make sure you talk to your physician when you're being treated about trials that are available. Trials doesn't mean experimental in the sense that you're not sure what the outcome's ever going to be. It's just that you're going to get better care. The trials mean that you're going to be getting the most advanced treatment opportunities that are available, and you might even get treatment options that wouldn't normally be available to somebody off the street or in a normal clinic. So you're actually getting something that's more advanced. And it's not that the drugs have never been used, they just may not have been used in that fashion.
You're not a guinea pig.
Thank you. Wow, that was really a much shorter way to say
yes,
that.
well, I mean, you get that a lot. You describe clinical trials to people, and people will say, "Oh, I'm not sure I want to be a guinea pig." You're not. Nobody wants to do that. But even if we wanted to, the regulatory bodies, they keep us doctors in check. We can't do anything dangerous. The studies that are out there, even if it's a blinded, randomized trial where you don't know what treatment you're going to get when you enroll, you will not get unsafe therapy. The worst therapy you could get is the standard treatment you would get if you didn't participate in the study at all.